Hey there, Micah Bongberg, Vice President of Commercialization with Avive. I'm joined with Dr. Ben Abella. One of the things that I've always enjoyed about talking to you is that you use data and research as the basis of forming opinions. One of the aspects of our defibrillator that you're aware of is that we have an opportunity to share more data, new types of data in new ways, much faster. And so I'm curious if you have opinions or can share more on how would that data be used, what types of things could be done having access to data faster from an AED.
I think a major unmet need in the whole industry has been getting data from AEDs to providers. This is not unlike times gone by to get ECGs from patients who may or may not be having myocardial ischemia. Getting data from the field is so important and often underappreciated until you have it and you realize just how valuable it is. So it is often the case that emergency providers don't get the information they need from the field of all sorts. Was someone doing CPR? Was the patient having symptoms before they collapsed? What was the initial rhythm? These are significant things, and we often teach in emergency medicine practice for residents that it's essential to get all the information you can from the field, from the EMS providers before they leave, because once they're gone, the information's gone. This is especially salient in the world of AEDs, because AEDs are not really in current practice part of a system. One might be owned by a health club. One might be in a restaurant. Which make, which model, who owned it, who's responsible for it. As an emergency provider in the hospital, it's really hard to get that information. I'm just worrying about the patient in front of me. If someone were to hand me that information, I would be thrilled, but it's gone. And in so many cases, when we admit people to the hospital, we barely know if an AED was used, let alone what the rhythm was. Now you might ask, why would we care? Why is it important? Well, the initial rhythm is crucially important for a number of key decisions that come next. For example, if a patient is post-arrest and they go to the cath lab and they're found to have clean coronary arteries and their initial rhythm was ventricular fibrillation, that's a clear indication for ICD placement. If you don't know if it was a shockable rhythm, you don't know whether they need an ICD or not. You might discharge them without an ICD, and if they have an underlying condition that predisposes them to cardiac arrest, you're setting themselves up for trouble. So that's one example of several I can think of where the data is hugely valuable. And to have data of timing, of when CPR was delivered, of how many shocks were delivered, these are also very important and very useful for a lot of the things we do in the hospital.